Good morning, everyone. Thank you for joining us for today's monthly webinar with Autism Health. We are going to start off with a brief presentation from myself, and then I'm going to hand things over to Dr. Doniparthi. And Dr. Doniparthi, thank you for joining us today. I'm grateful for your time and consideration and expertise. So I'm going to go ahead and get started. I usually go through this pretty quickly. All right, so we are a nonprofit organization and we are dedicated to funding scholarships and providing resources for families who are impacted by autism and other neurological disorders. Our mission, our organization is dedicated to educating and empowering individuals, families, and communities impacted by autism, spectrum disorder, and other neurological disorders. Through workshops, events, parent coaching, and personalized support, we address the unique needs of each individual. We connect families with trusted resources, including medical professionals and specialists, to ensure individuals with autism receive the comprehensive care they need to thrive. We also provide caregivers and professionals with the knowledge and tools to support meaningful growth, assisting individuals with autism to lead healthy, fulfilling lives without limitations. And so our main four core values are to educate. We want to provide families and professionals with access to the latest research in integrative health and how to address those underlying conditions. Community, I believe it is very important to get yourself involved in the community, to connect with those practitioners, those other parents, those advocates to help support you on this wonderful mission that us parents are on. Compassion. Our goal here at Autism Health is to help remove those financial barriers. We help support those who are low income with scholarships to attend our conference and other events. And we also, in the future, once we establish more funding, would like to assist in help funding biomedical intervention as well. Empowerment, our main job is to, I also want to say, inspire individuals and families by providing them with the support and education and resources, because knowledge is power. And I couldn't do this without my amazing board members and advisory board. My husband and I founded this organization. And along with my board of directors, I have Melanie Dokis, Christina Bourne, Mia Romero, and then my board members, Patricia Marone, Jackie Christensen, Jesselyn Castellini, Amy Schaffert, who is joining us above, who helps us with these webinars, and our newest member, Colin Carley, who is on the spectrum himself, and he gives us great insight as to his own perspective, which is super amazing. And our wonderful advisory board, Joseph Sliskovich, James Lyons-Wheeler, Dr. Bartlett, Dr. Jerry Kartzenell, and Dr. Maria Humbert-Mock. So we do have a little bit of a call to action. If you could take the time to just donate $25 or a reoccurring, $25 a month, or even if it's $5 or $10. Every little bit adds up and every little bit makes a difference to keep this organization functioning. And when I say keeping it going, so I'm able to provide these free webinars every month and also the support groups every month and everything that we do as an organization, and our annual conference, which is coming up in April 24th through 26th, the Autism Health Summit. All those things, are what assist these families and these professionals in, healing our autism community and addressing those underlying conditions. So I kindly ask for your support, however that gets to look. and we are truly grateful. So, again, we thank you for joining us. We are super excited to announce our speaker. Today, we have Dr. Krishna Doniparthi, MD. Dr. Doniparthi is part of a movement of physicians leading a shift in healthcare, board certified in regenerative and functional medicine, family medicine, and obesity medicine. He earned his degrees from Loyola University and Grace University Medical School and was chief medical resident at the University of Alabama. His current practice, Functional Medicine Georgia, specializes in cellular detoxification for patients with complex epigenetic driven conditions. And that is what a lot of these kids with autism currently have. So I am going to stop sharing and I'm going to give the floor to my speaker, Dr. Krishna Doniparthi. Thank you for joining us.
Thanks, Tracy. And suddenly my name changed to Hema Doniparthi for some odd reason. There's technology for you. Anyway, yes, I am Krishna Doniparthi, and I'm going to share my screen and pull up my slides. And I promise I'll leave time at the very end for question and answer, and and let's have some fun. All right, Tracy, can you see my slides?
Yes, I can see him perfectly. Thank you.
Okay. Well, today's talk is about foundational biological substrates, and I'm going to explain some of these terms. I think everyone here knows what autism is, and I think people have an idea what toxicity is, but we're going to try to understand what is it about toxicity, what is it about our cells, and what can we do about it that creates autism and how to possibly relieve some of the symptoms from it. So, as Tracy said, I do own a medical practice, functional medicine of Georgia. I'm in Alpharetta, Georgia. I've been practicing functional medicine for pretty close to 20 years. And functional medicine, for those who don't know, it's about addressing the root cause. In this case, it's an integrative approach, and not all of it is holistic. There are some times with you need to use medications, but it's less times than not. And I'm also a member, fellow, and faculty at MAPS, which is known as Medical Association for Pediatric and Special Needs. It is a premier medical organization that focuses on autism, but other things that are all things pediatric, usually on the neurological side or and so on. But it is a functional medicine pediatric approach. And if there's any practitioners on this webinar today, I would highly recommend that if you would like to learn more and you should join MAPS. The other one is Doniparthi Neurogen Academy, or DNA for short. It was established in 2024. It is a nonprofit organization that I focus on teaching healthcare practitioners all things about fatty acids, phospholipids, plasmalogens, and other things called short chain fatty acids. Like Tracy, we take donations that are directed towards research, testing, and helping those who cannot afford either the testing or the products to help them get over autism or other neurological conditions. So today, be open-minded, but not so open-minded that your brain falls out. So today, the theme is going to be about changing your cells in order to change your health. And this is the foundation of phospholipids and what they can do to our cells. In our cells, we are made out of, as a human body, approximately 7 to 10 trillion cells. That's a lot of cells. And so we're trying to affect each and every one of those, particularly the brain cells, but it doesn't have to be that way. And when it comes to detoxification, when we say we have toxicity and do we have a way to escape it, the the answer is yes. There is a natural form of detoxification, and that is done by phospholipids. I lecture on other things, and they are just as important as phospholipids. Those are called fatty acids, butyrate, and plasmalogens, but mostly today we're going to be talking about phospholipids. And if we didn't have this mechanism, we would probably perish very early in life. I would imagine we wouldn't get past age 5 to 10 if we didn't have phospholipids. That's how important they are. So just to kind of clear up some words and define them correctly, a supplement is an additional nutrient not found or made in the human body, whereas a substrate is a substance that's made in the human body, and we're going to just take more of it. And I like to start here and talk about those 7 to 10 trillion cells that make up the human. And each one of those little cells is a little factory. And if you think of it kind of like in this analogy, there's a lot of things a factory does. There's delivery, there's raw materials, and I'm using the biological equivalent of that. So when I say raw materials, we're talking about vitamins, minerals, amino acids, fatty acids, a lot of these things that you already know. There is a front door. It's called the digestive tract. It starts with the mouth and ends on the other end. And we have workers. They're known as enzymes, and NAD is a coenzyme. We have a security control. That's the immune system. But in addition to that, we do have a way of getting rid of things out of our body, and that would be the equivalent of a smokestack. There's defecation, urination, perspiration, exhalation. Those are all ways we can, manners in which we can get rid of toxicity out of our body. What I like to kind of focus on are the two words in red. One is the mitochondria, and that has a particular kind of substance called cardiolipin. The other one is really the structure of our cells, or in this case, the analogy of a factory. You can't have a factory without a walls and a ceiling and a floor. And that structure in the cells is created by phospholipids. So, in the analogy of a factory, you just can't buy equipment and conveyor belts and hire workers without having some kind of building to house them in. And that's what phospholipids do. They're the housing for all things cellular function. In the mitochondria, this thing called cardiolipin is very important. And cardiolipin is two phospholipids joined in the middle. And I'll show you a little bit more information about that later on. So generally speaking, what do phospholipids do? Well, they surround the cell and the inner parts of the cell, all these little pieces of the cell that you see here. And they should allow good nutrients in. And as the cell works, kind of like a factory, it does produce some, you can say, refuse or smoke or however you want to say it. We have the same thing within our cells. We have what's called cellular respiration. And that cellular respiration means the cell is working. It makes some stuff that you got to get rid of. So bad toxins out. Or even in the case of things that get into the cell, this could be infections, toxic chemicals, toxicants, and so on. Those are should be pushed out. If they're not, then the cell becomes dysfunctional or abnormal. So toxicity, what you need to know about it is that it starts very early. And this is a study that was done in 2004, and it was done by the Environmental Working Group. And what they were trying to assess is to see if newborn babies have toxicity. And they were trying to analyze and give some background to the amount of chemicals that are found in US industries. Of the 75,000 chemicals, 3,000 are used in very large production amounts. In this case, in this study, they sampled 10 new babies, 10 umbilical cord samples, and the entity that actually drew the blood was the Red Cross, so that there wouldn't be any bias. The samples cost $10,000 each, and so they spent about $100,000. And it's expensive because they were trying to check for a variety of different chemicals. And what they found was 287 were detected. 180 that can cause cancer, 217 that can affect the nervous system or the brain, and 208 that can cause birth defects or other kind of abnormalities. And this is a sample of what was found. And so in different categories, if you see a more not lighter shade, but darker shaded substance, that means that was present. In this case, mercury is one of the chemicals or metals that was found, but you have polyaromatic hydrocarbons, PBDDs, PFCs, all of these, organic pesticides, and these, and I have one more page. And so if you're wondering, wow, is that a lot? Yeah, that's a lot. And so whatever this X substance was, substance X, what it can do is, and what people don't understand about toxicity, is that it can attach to our proteins or our DNA. And if it does that, we're going to lead the cell down cellular dysfunction and inflammation. And the moment the cell starts to become dysfunctional, well, it can't work and it can't do its usual work. And inflammation has even a more profound effect, especially in the brain, where brain matter will get destroyed. And the other thing to understand about toxicity is that, and there's a now a emerging kind of medicine called preconception medicine. What we need to understand is that a pregnant woman, if she has a baby, that baby, especially if it's a female baby, that female baby is carrying the ovaries that carry the eggs for the next generation. That means that whatever toxicity the mother has, the nutrients or toxins are passed through the umbilical cord to the baby, and the baby passes them on to, at the time of birth, those ovaries are mature and the eggs are all mature. And those eggs also harbor the same toxins and toxicants that the mother and the baby were exposed to. Another way of kind of understanding this is what Harvard mentioned in epigenetics. That means that in this case, on the far left, generation one, if the mother smokes and has a baby, and that little blue dot mean is what I was just representing, is the same future generation if it's a female baby. The chemicals found in cigarette smoke will get transferred to the baby. And if that baby goes on to generation two and tries to have a baby, well, now the mother might have some issues with weight gain, and this baby is affected, and you don't see a little red dot, kind of the opposite here, showing that that this baby can have for infertility issues. So when this baby grows up and tries to become pregnant, can't. And kind of looking at the diagram that the toxicity may be causing weight gain issues, which has its own effects in terms of on health. So we're trying to break this cycle, and that's what this picture is representing, what preconception medicine's all about. Is there something we can do besides just simply avoiding toxins? How do we clean up our cells? So we can break these kind of cycles and create a new paradigm shift. Our personal toxic burden is just that. It's personal. Everyone is different. Some people have more toxicity and some people have less. And there is ways to measure our toxicity level, albeit it's not perfect, but we can understand some components. And sometimes people with less toxicity can be sick, and sometimes people with more toxicity may not have any health issues. And there are a variety of different factors that focus on this, everything from genetics, nutrition, lifestyle choices, and so on. And so I wish I could tell you that having a particular something is going to lead to something. And I get this question asked a lot about vaccines. How come all children don't develop autism after a vaccine? It just depends on what the mother's toxicity was prior to conception and what the baby's toxicity is at the time of vaccination. So that in understanding personal toxic burden, where does it come from? Well, it comes from toxicants, medications, chemicals, environmental chemicals, and mycotoxins. That's a small list. It's not a comprehensive list, but it creates toxicity, but not a disease state. As time goes on, something might happen and I have an example of vaccine or infection that now converts the person from a less toxic state to a more toxic state and now also becomes diseased. And this is, again, something that we can try to avoid, and preventative medicine uh, is the most important, or try to help reverse some of this. And there's lots of different poisons. I don't think this is an exhaustive list either. Some of these were my favorites. Not so much smoking, but Twinkies. I loved them when I was a kid, and Coca-Cola, but loaded with chemicals. And we have antidotes, and that's the thing. that there is hope. There is ways to reverse all of these poisons that come into our bodies. And I kind of separate this into two categories of what we should understand and what we need to do. Number one is damage control. Know that there's lots of different ways we can pick up things. Bad environment, air, food, and water, poor nutrition and medications, undue stress, of course, vaccines, and even strenuous physical activity is difficult on the body, and that can lead to damage. And then under damage repair, we're going to be talking about phospholipids, a little bit about plasmalogens. Nutrients are very important, definitely good nutrition, and even good gut health. So a little bit about what the cells do. And I know I mentioned we are 7 to 10 trillion cells, so we need to understand what each one of those little factories are, how they're composed, and what they normal function is. So changing your cells can change your health. And this is a cut section of what we're going to be talking about called phospholipids. This is the coating around, and these are the little red with the little yellow tails, red heads, yellow tails, of what every single cell in our body is surrounded by. These phospholipids create an environment for other things, everything from ion channels over here, receptors on the outside, or other kind of protein molecules. So the question is, well, what do they do? Well, it's called membrane trafficking. It means the ability for things from the outside of the cell to enter the cell, or things that are made inside the cell, good or bad, to depart the cell. So protein channels, ion channels, how one cell can talk to another called cellular signaling, and diffusion of nutrients, and ways of bringing things in and out called endocytosis and exocytosis. All of this is dependent on the cell membrane. Poor cell membrane, poor membrane trafficking, things just can't get in and out correctly. And inside the cell, all the little parts, and they're all described here, and what their function is, some of these are what we call membrane bound. They're bound, or their boundary is created by phospholipids. And so this is where phospholipids are just as important in understanding what they do for the outside of the cell surrounding, but also inside the cell. And just kind of like membrane trafficking, inside the cell, we have cellular trafficking, how all these little parts talk to each other or able to talk to each other. And this is a cartoon section of the mitochondria. And mitochondria is very important as it's the only place where energy for the cell is produced. And the squiggly lines that you see in the background, those are the phospholipids. By having the phospholipids, these protein structures that allow to make energy or ATP at the very end are only dictated by the fact that the phospholipids are there. It's kind of like saying a house where you cut out a section of the house framing in order to put a window. You can't have the window first. The window comes as a result of the framing of the house. The same is true within the cells. You can only have these proteins as a way to cut out a part of the phospholipids to create some space for each one of these things. And in the case of the mitochondria, it is one of the locations where cardiolipin is so important. It's made out of two phospholipids that are joined in the middle. Without the cardiolipin, you cannot make ATP or the energy. It's so important, these phospholipids, that genetic material, or what we call crosstalk, we used to think that the DNA was the most important part of the cell, and it is and it isn't. Really, it takes more instructions from the phospholipids. The phospholipids are the ones that can dictate how information is shared. And in fact, the shared information of what a DNA needs to do has to get its help from the mitochondria. The DNA sends a signal saying, hey, I need help making whatever protein. And the mitochondria says, okay, I will help you. But there is a connection between the DNA and the mitochondria utilizing phospholipids, kind of like a tunnel between the two. So very important. Having phospholipids allows for the DNA to work that talks to the mitochondria to make whatever substance the DNA needs to make. A little bit about brain transmission, and this gets a little bit complicated. I hope people will find this a little simplified because we're talking about something that many do not know about phospholipids and its cousin version called the plasmalogens. So the brain is divided into two kinds of sections, what is called gray matter. I'm sure many people have heard that, and also white matter. Gray matter basically is where signals start, and it accounts for 40% of the brain. And white matter is a way of getting the signal from one gray matter area to the other. And it actually smooths out or makes whatever the gray matter is doing look normal and smooth. So right here in the middle, this is known as the motor cortex. And I'm going to come back, I have a slide explaining a little bit more about the motor cortex or the motor neurons here in just a little bit. In terms of what makes up our human body, we are 80% phospholipids and about 20% plasmalogens. And they're both kind of involved in cell signaling. Plasmalogens a little bit more helpful with oxidative stress. But when it comes to toxin and toxicant removal, well, that's mostly phospholipids. And when nerve cells need to talk to each other, you need a little bit of both. Plasmalogens have a little bit of extra benefit here. So the difference between gray and white matter is kind of like I have a picture here of a very generic nerve cell. This is the gray matter, and the other end is the gray matter. And in between, from one end to the other end, is the white matter. And the white matter is made out of this stuff called myelin sheath. It covers what's called the axon or the cord that goes from one end of the nervous neuron to the other end, kind of like an electrical cord. One side plugs into the wall, the other into an appliance, but this middle part is just as important. In fact, it is way more important because if this electricity that is being conducted from one end to the other end, if it cannot get to the other end or goes off in a different direction, well, then you really don't have a very good functioning brain. And this is exactly what phospholipids and plasmalogens do. So gray matter is mostly a chemical reaction. White matter in the middle is an electrical reaction. And when one nerve cell needs to speak with another, it's a gray matter or a chemical reaction. In the case of what we're going to be talking about today, gray matter is a combination of phospholipids and plasmalogens. The white matter, the middle part, is sphingomyelin, is a plasmalogen product. And then again, when two nerve cells need to talk, it's a combination of phospholipids and plasmalogens, especially as it relates to NT vesicles or neurotransmitter vesicles, or the little chemicals that allow for one nerve cell to talk to another. And so it's kind of like this. So in the case of motor function, let's say I want to say a word with my mouth here on the very end. The gray matter starts to say, I want to recall a word. The white matter says, I need to say the word. Gray matter connects to another nerve cell and so on until it gets to the mouth and you can actually do whatever function it is. In this case, saying a word. And that's motor function, the ability to move a certain part of our body versus sensory function means the ability to feel things, whether it's hot, cold, soft, hard, and so on. So this is that phospholipid bilayer I was telling you about that's around every single cell. It's composed of four kinds of phospholipids. They're listed here. And mostly the PC kind is on the outside and the PE kind is on the inside. It lines up like this and it actually creates a curvature for the cell. To create a phospholipid, you need one head group, and that's either choline, phenylamine, inositol, or serine, and what we call in science fatty acids, or what most people know as fats and oils. In the human body, we have 40 different kinds. We only have four kinds of head groups. So one head group, two fatty acids gets you one phospholipid. So this creates the structure of our cells. Intermixed in here is cholesterol or good cholesterol. And that's just as important. So phospholipids, the PC and the PE kind, and cholesterol make up the structure of the cell. And this is, again, every single cell in the human body. I was mentioning a little earlier about neurotransmitters. And what I'm showing you here in this cartoon is that these are the phospholipids. And in order to create a little pouch for anything that needs to enter or exit the cell, we call these vesicles or droplets. And this is a scanning electron microscopy showing those how they are found on the nerve cells. So this is where neurotransmitters are stored. You can only store them because of phospholipids and plasmalogens, and or releasing them from one end to the other end. And so very complex. Many practitioners don't know this, but this is how, if you don't have enough proper phospholipids, you cannot store neurotransmitters and you cannot properly release them either. A little bit about autism and neurodevelopment. In this study that was done trying to differentiate between autism and Asperger's disease, there are certain criteria that define autism. One of them is delay in language development. And the other one is deficits in understanding verbal instructions and indications. In the case of autism, as compared to Asperger's, 95% of those affected with autism have a delay in language development, and about 50% of them have a difficulty in understanding verbal instructions and indications. Here's what they're not. They're not having issues with learning difficulties. 98% of those affected with autism do not have a learning difficulties. This is what they're not. What they are is a motor neuron issue. What I'm trying to say is that they're understanding everything that is being taught to them, what is being said around them. They just have a problem with moving their mouth, lips, tongue, cheeks, and blowing the air out through their windpipe. So that is a motor neuron issue or even a neurotransmitter issue. And this is best exemplified if you haven't seen the movie Spellers, you should. Spellers is a movie indicating how children with autism use spelling or spell to communicate, S2C, spell to communicate as a way to say what's on their mind because they're not able to engage in motor activity correctly because their gray matter and white matter are affected. This is a study that looks at what do phospholipids do in terms of toxin neutralization or removing toxins. The first step is that any kind of toxin, most of the time they're protein toxins, whether they come either from bacteria or fungal or mold issues called mycotoxins. Those, when they come into our body, our phospholipids trap them and then eventually push them out. And this is also true, and I don't have the slide here, of medications, which would be foreign to the body, or other things that are foreign in the case of snake bites or even bee stings. And a quick science description of the understanding of phospholipid and its cousin version called a plasmalogen. Please don't try to memorize any of this. But a phospholipid, this is a basic structure. It's called has a 3-carbon backbone with a phosphate group. X is that head group I was telling you about that could be one of 4 things. And R1 and R2 are where the fatty acids are attached. No different in a plasmalogen. R1 is mostly a saturated or a monounsaturated fat. People should not think that saturated fats are bad for them. That is just hogwash. We need them for phospholipid production. R2, the second fatty acid, tends to be more polyunsaturated fat than monounsaturated fat. And the only difference between a phospholipid and a plasmalogen is that this one is called an ester bond, where this double bond is up here. In the case of a plasmalogen, it's down here, also known as an ether bond. So where do these all come from? Well, the production of phospholipids starts with our liver and our good gut health, or we should have good gut health. All of the fatty acids, phospholipids, and plasmalogens, I'm using some abbreviations here, are made in the liver, a vast majority of them. Fatty acids that are made are assembled into phospholipids and then further modified into plasmalogens. The place inside the cell where this happens is called the endoplasmic reticulum and the peroxisomes. These are supposed to make the fatty acids, and then they further modify it in the same location to phospholipids, and then finally to plasmalogens. I'm simplifying the chemical steps here, but generally speaking, this is how it occurs. If there's an issue, and there's lots of issues with the endoplasmic reticulum or peroxisomes being affected by chemicals, then this process does not go forward very well. And so fatty acids become compromised. And if fatty acids are compromised, phospholipids are compromised, and on to plasmalogens. And so this happens in the liver. And if the liver is dysfunctional, you can't make these, and then the rest of the body suffers as well. There is a way to break this up. We can reduce endoplasmic reticulum and peroxisomal stress by using a substance called butyrate. And that helps to clean these up so all of this process occurs. There's a lot of different reasons to use phospholipids, or what we would simply call LRT, or lipid replacement therapy. And this is a list of both for kids and adults. I've highlighted autism, epilepsy, PANS and PANDAS, and seizures, but really, I know kids are also affected by mold, Lyme, and other things. So very good for all of these kind of conditions. When it comes to testing options, there are ways we can figure out what's going on, and I'll show you samples of each one of these tests. The fatty acids, those are the ones made by the liver, and again, we have 40 different kinds in the human body. 12 are very common. This is studied, or this test is done at Kennedy Krieger Institute Peroxisomal Laboratory, and that's at the Johns Hopkins University. Phospholipids are go to a place in California, in Temecula, California, and that test is known as prodrome scan. It's a test that Dr. Dan Goodenow has developed, very useful. FRAT test stands for folate receptor antibody test. This is to look at to see if some kind of environmental toxin is stuck on the folate receptor in the brain. And if you've heard the news, this is where leucovorin is very helpful, and where DHS is trying to clear the avenue to make leucovorin more available for the treatment of autism. And then finally, stool analysis. The one I prefer is doctor's data, which is known as the comprehensive stool analysis and parasitology test. And I'll show you why. So this was a patient of mine. This test is no longer available. It was done in Germany. It looks at intracellular uh, toxins and toxicants. And this is not an exhaustive list. And I point this out here that there's a variety of things going on, that it's not always about aluminum or mercury, although those are important in terms of autism, but there are a lot of other chemicals that can be found inside of our cells, whether it's mycotoxins like the very first one listed called aflatoxin, or further down fumonisin, or environmental chemicals, organophosphates, triclosan, and so on. Why this is so important is that these things can accumulate, and I can't tell you, in this case, which one of these is causing the cells to become dysfunctional, whether it's in the brain or elsewhere in the body. What I can tell you is that these are before and after phospholipids. You can see the levels on all of these have greatly been decreased. The next test is called a prodrome scan. And this is actually a patient of mine who is affected with autism. And in the one on the left is the before, and the one on the right is the after. What we're looking at here is the phosphatidylethanolamine. That's one type of phospholipid, and PC, the other most abundant phospholipid. And I'll tell you a quick cheat sheet on this is that all of these bars, or most of these bars, should be way up here in the 80 to 90% range. And you can see here this my patient, her phospholipid, the PE kind and the plasmalogen version, very low at 15 and 17%. With phospholipid treatment, you can see here that her numbers have gone up, including the kind that allow for the gray matter to work better, called DHA kind, whether it's the phospholipid or the plasmalogen version. And even the PC versions of all of these improved as well. In terms of sphingomyelin, this is that nerve coating I was telling you about. And this is a good number. 70 to 90% is where it should be. It went down a little bit, but this is not a bad thing. This indicates that her brain is healing and repairing itself by using up the raw material, sphingomyelin. There was some mitochondrial dysfunction, and this fatty acid called adrenic fatty acid was increased. This is one of the few things that should be low. It should be around 30%. It was high at 68%, came down a little bit to 53%. This indicates to me that her mitochondria is coming back on board. Her cholesterol improved. Remember, I said cholesterol is part of the cell structure. It improved from 185 to 205. Next is that FRAT test, folate receptor antibody test. In this case, this is a patient of mine who had binding, or one of two things can happen, binding or blocking of the folate receptor. In this case, something was binding to it. And the answer for here to relieve this is leucovorin, or analog of vitamin B9, which is usually available through compounding pharmacies. Next is stool analysis. Stool analysis is very important to get at the beginning of understanding and treating any kind of medical condition, because our gut is way more important, as it's the kind of like the gateway of how toxins and toxicants enter the body, go from the foods that we eat or the things that we drink to our liver. So in this case, this is a patient of mine who had 4 extra bacteria, and all 4 of these were gram-negative bacteria. There's only 2 kinds of bacteria that can be present, gram-positive and gram-negative. Gram-negative kind, like the ones that are here, are very dangerous. They can create their own kind of toxin. It's called lipopolysaccharide, or LPS. As these are made, if someone has damage to their lining of the gut, or what we call a leaky gut, these lipopolysaccharides can go from the gut to the liver, damage the liver that makes all the fatty acids, phospholipids, and plasmalogens, and then go on from the liver to the rest of the body and damage organs and the brain. The other one is the overgrowth of yeast. And we all have a little bit of yeast, but it should be in very low numbers. Excess amounts of yeast can create their own toxin, and in general, they're called mycotoxins. And it has the same kind of effect as LPS. They can damage the liver and the rest of the body and brain. So this is the reason to get a stool analysis. Well, there are treatment options. This is all not bad news. Know that we can do things to help clear up cellular toxicity, or what I call damage control, and rebuild the cells, what better known as damage repair. The treatment options are available either in oral or intravenous forms, but really it starts with the first thing, nutrition. Eat more of this and avoid these things. Eat more naturally raised meats, eggs, and vegetables as much as possible, and try to avoid the things that our bodies don't really need, and as a result of the chemicals or mycotoxins found in them. In this case, grains, dried food substances, and dairy. We can take certain substrates, and again, remember, substrates are things that are either made or found in our body naturally. Those include fatty acids, especially what are called the essential fatty acids. Those are the fatty acids that we have to derive from the foods that we eat, phospholipids, plasmalogens, butyrate, the compounded version of butyrate called sodium phenylbutyrate, glutathione, oxbile, and TUDCA. Those are things that can help with damage repair. Other ones are the supplement versions. Supplements, again, are those that are not made in the body, but we can use them. In this case, leucovorin is B9, folinic acid, and it's very specific. It's pharmaceutical grade B9, not any old folinic acid. Methyl B12, vitamin D3, K2, multivitamins, minerals, and even probiotics, like VSL number 3. And I use this with my patients and parents of children about what do I give. And this kind of summarizes all the different kinds of supplementations that are available. And I'm not trying to discount anything else like botanicals or other kind of supplements. This is kind of like the basic of the basic. And I separated them into four tiers. Tier one is a multivitamin mineral, D3, K2, electrolytes, and minerals. Tier two has to do with gut health and detoxification, or the start of it, and that's oxbile, TUDCA, and butyrate. Next, if you want to get into cellular repair and detox, well, now we're talking about phospholipids, fatty acids, plasmalogens, and glutathione. And in severe cases, there are IV forms of certain things, phospholipids, only the PC kind, sodium phenylbutyrate, and glutathione, and even leucovorin should be in here, but I just didn't have enough space to stick it all into this small little triangle that's left. So tier one would be these kind of nutrients or supplements, multivitamin, D3, K2, electrolytes, and minerals. Under gut health, there's oxbile, TUDCA, and butyrate. And finally, when we get into cellular repair, we have phospholipids, fatty acids. I'm going to pause for a second. I'm going to make sure my slide. Tracy, can you see my slides?
No, it's black.
Okay. When did it, I guess my question is, when did it stop?
Just after the supplements.
Okay.
I saw the glia and neuro though.
All right. Let me reshare. Technology, you got to love it. Can you see my slides now?
Yes.
Okay. All right. So treatment options, nutrition, substrates, and supplements. The substrates, again, these are the ones I would recommend for cellular repair, supplements as well. So the supplementation is divided into four tiers, which I mentioned. One for basic cellular health. Next is for gut health and the early detoxification. And finally, cellular repair and detoxification. And then in severe cases, IV forms of PC, sodium phenylbutyrate, glutathione, leucovorin. Tier one is multivitamin D3K2. Some of these I've created myself because I just didn't find a good product on the market that addresses minerals or electrolytes correctly. Here, these are all commercially available for gut health and detox, oxbile, TUDCA, and butyrate. And giving you some examples of companies that make these. And then finally, tier three, this is where phospholipids, fatty acids, glutathione, and plasmalogens come in for true cellular repair and detoxification. Not all products are equal, and I want to explain a little bit about phospholipids. There are many products on the market, and what I'm showing you here is one that has all four phospholipids, PC, PE, PI, and PS, and the building block called PA. And in this case, Essential PL is a sunflower product versus what most of the products on the market are soybean. And there's a lot of differences between sunflower and soybean, especially when we're exposing our kids to certain products. We want them to be the safest as possible. In the case of sunflower, it's mostly hypoallergenic. It has a particular fatty acid called oleic fatty acid that's good for production of sphingomyelin that makes the myelin sheet. And because sunflower is naturally organic, you don't need to spray sunflower, whereas soybean is mostly not organic kind. And sunflower is not GMO, and in the production of it, there's no alcohol involved. And while there's a little bit less PC as compared to soybeans sometimes, it's really based on the harvest. There is more higher PE content. This is really important. This phospholipid, PE, which goes on the inside of the cells, is the one that creates the curvature, but PE can be converted to PC, and the cells can do that on their own. So PE is actually kind of like two phospholipids in one. It can be PE or it can be converted to PC, depending on what the cell needs. The flavor is more neutral in sunflower, a little beany, nutty flavor in soybean. It resists oxidative stress, so you don't have to worry about it spoiling on you. And the process of getting it is cold press, whereas most soybean is dried with solvents or hexane. Excuse me. So in functional medicine of Georgia, if you need help, I would be more than happy to evaluate with testing and customized protocols. The information is here. If you're a parent and you're wondering, well, who's in my area? I would encourage you to go to MAPS website, medmaps.org, to look up for a practitioner in your area. And there are different levels of MAPS members, those who just attended versus those who are fellowship trained, but they will be able to give you some information as to what to do. Next is for practitioners. If you're a practitioner on this call and you want to learn more about fatty acids, phospholipids, and plasmalogens to use in your practice or for peer-to-peer support, contact me at dnadr.org. Or if you want to learn more about this or what we do at MAPS, which I highly encourage you to come join us for the next conference in Charlotte, North Carolina. The code is here, DNA 2026. If you use that, you'll get 20% off your registration. And I'm sorry for the coughing. I think the dry air in Atlanta is finally getting to me. If you need more information about some of the nutrients or supplements that we were mentioning in this talk, you can go to nutrients.health and learn more. So in summary, you can't begin to learn what you think you already know. Um, and with that said, I'd like to open it up to discussion. I hope my slides presented all the way to the very end, but let's see if anyone has any questions.
Okay, so our first question is, we go to the top. Why is it yesterday I had trouble with MCAS by slowly introducing my H1 and H2 blockers, children's Claritin and Pepsid AC with Glia oil. Glia oil was really working well with just seasonal allergies. Claritin.
Yeah. So just know that when cells improve and you're reorganizing the cell structure, the outer coating of the cell membrane. Remember what the cell membrane does. It allows for things to move in and out. As cells, and that's true for medications. If you take any kind of medication, you're not trying to affect the blood, you're trying to affect the cells. And when cells improve with administration of phospholipids and plasmalogens, they don't need as much. And so you can have issues with medications or hormones even, where they now suddenly work better than they did before. So sometimes you need to back off or use less of a hormone or a medication.
Okay, how long would you need to take phospholipids to clear toxins? What are the doses?
The phospholipids can be, you can start off, you should always start off with any of these as low amounts, usually 3 to 5 mLs once or twice a day, and work kind of up to a certain level of 5 to 10 or 10 to 15 milliliters once or twice a day. What you're trying to affect is all of the cells in the human body. Remember, there's 7 to 10 trillion cells. They're all made out of phospholipids and plasmalogens. And so it can take time. What I found is in my practice, what I used to do 10 years ago is now taking me longer. And I think it has to do with toxicity levels. So in the past, I was able to help adults or children in a relatively short period of time, 8 to 12 weeks. But I think, Tracy, as the toxicity in our society is building up, and I'm so happy that organizations like MAHA is helping out to reduce the toxins in our air, food, and water, it's taking longer. And oral works just as well as IV. It's just that IV is a little faster. So nowadays, it might take 6 months to a year to clear out the toxicity. And I know that's kind of like not good news, but the answer is we still have a way, we still have an antidote to help. So that's what I've noticed is that it's taking a little longer. I think on average, I would say 3 to 6 months, but everyone's different because everyone's toxic burden is different. Their lifestyles are different. Their nutritional intake is different. I hope that answers the question.
I think so. Um, Someone is asking if you do telemedicine.
Yes.
Okay. So they can just reach out to your office to make an appointment.
Yes.
Okay. Elizabeth is asking a couple questions. Does age play a factor in being able to repair a child?
There's two phases I think parents need to understand about children. Brain development and brain growth. Brain growth is about till about age 7. Brain development goes on into mid 20s. the and I use the analogy of a house. If your house is burning down because somehow a fire started, how quickly do you want to put out that fire? Well, you want to put it out as fast as possible. And I think one public service announcement that should be made over and over is that if you think someone is affected by whether it's environmental toxins, a vaccine, mold and fungus, treat it as soon as possible because the less damage, the quicker it is to repair. Um, so when it comes to brain development, what I mean by that is the brain can learn new things all the way up until mid 20s. It's not that we can't learn things after the 20s, we still can. So if you want to learn a language, you want to teach a baby the new language, especially if you want to teach that baby I don't know, 4 or 5 different languages, that baby is going to absorb all of that information if the brain is correct and properly structured. So that kind of learning and development continues on to mid 20s. Can you still learn even after that? Absolutely. It's better known as you can teach an old dog new tricks. Can I, at age 50, learn a new language? Sure, I still can. It might take me a little longer versus when I was in elementary school or high school, but it can still be done. Just remember one thing I did mention earlier on. It is a motor neuron issue with the brain, especially as it relates to autism. It's not a learning difficulty. It's the ability to access that information and then say it out loud. So, parents with children with autism, you are teaching whatever you tell your child is learning, and you should know that. The other part where I mentioned about what you can do is that if they're watching TV, turn on the captions so they can read them. Read out loud with your lips so they can see your lips moving. That's how we communicate in the future. That's how during the pandemic, it was an atrocity when kids' mouths were covered up. They couldn't see anyone moving their lips or mouth. That's how we learn, one of the other ways we learn language. So all of these things can happen at a young age, but it can still happen at a later age. The earlier you intervene, the better it is.
And her second question is, how do you know if leaky gut is fixed? And do you have a wait until it's fixed to do a higher tier of supplements?
So leaky gut, there is a test. There's a breath test that measures the certain gases that are produced by bad bacteria. You don't have to do that test. Usually, it's very predictable. If you pursue a gut repair protocol, usually within 2 months for I would say 95% of people, they'll fix their leaky gut when they utilize ox bile, TUDCA, and butyrate. And so I used to do leaky gut testing. I don't do it anymore. The other way you can kind of empirically know is one, you feel better, but two, you don't have as many reactions to food. We should not have reactions to food that pass through our digestive tract. If someone's saying I have a histamine reaction or I feel don't feel good after I eat, chances are you have a leaky gut. So those symptomologies should go away.
And then do they wait till they start a higher tier of supplements?
No, actually, you can ramp up fairly quickly, usually within 2 to 4 weeks. And every person's different, and I would say it's sometimes personalized. But you do need to know what's going on a stool analysis. You need to know, are there any parasites, protozoa, which bacteria, which kind of yeast or fungus. It's all important. So sometimes we do venture out into medications that might be necessary to tackle certain things. Most of the time I can use botanicals, but sometimes I do use medications.
Okay, so next question from Carrie. What if you know for a fact that your kid, who is 18 years old, will not go grain-free, but she is already gluten-free?
Gluten-free is great. It is a protein that is not easily digestible by the digestive tract. Grain-free, I would say there are alternatives. Everything from cassava flour and other types of flour. If you absolutely, and especially I would suggest trying to make foods at home, you can use a particular kind of flour called einkorn flour that is artisanal flour. It doesn't have chemicals. It's very naturally low in gluten. And again, if you had to, and this is where I guess a little bit of bargaining comes in until the person is able to eat a more variety of foods or so on. But cassava flour is a great alternative to wheat flour. I've used it to make chicken nuggets at home for my kids, and you can't tell the difference. I've even taken cassava flour and made it into pie shells and so on. So there's alternatives out there.
Okay. So on that note, I have a question.
Yeah,
So I have recently discovered the joy of milling my own organic grains. So, do you know much about in regards to milling organic wheat berries without sifting out the wheat bran and the wheat germ, which still contain
yeah,
those supplements that we need, that folic acid, um,
yep.
and isn't processed? What are your thoughts on that?
I think artisanal grains are just that. They unfortunately most of the grains found in stores, and for those who don't know, you can take organic foods and still have them sprayed with glyphosate, and they can still get away saying that they're organic.
Yes.
So it becomes a little tricky, but I do like your idea of wheat berry and utilizing the entire grain. You're absolutely correct. The micronutrients and the macronutrients are there, everything that we need, and I would say is God-given food. And so we're not trying to change that up, but it's really, if we can go back and maybe spin the time clock 100 years ago, I think we were living much better because there was less chemicals and in our foods. So yes, when people say that I've gone to Europe and ate their local breads, they feel better. They don't get the bloating, they don't get the headaches, they don't get the joint pains. That's because there's less chemicals in European foods, especially the grains. So yes, I'm with you, Tracy. I'm coming over to your house.
I mean, I just recently learned about this. I got a Miller for Christmas. I still like the taste of gluten-free better because I've been gluten-free since before it was cool, which is almost 20 years now. But for those of you out there, milling your own grains is not as easy to bake with. But you still get that folic acid, your vitamins. You're not getting the synthetic vitamins. You're not getting the bleaching that comes with, and once you've milled a wheat berry, it automatically starts to oxidize. So using it right away is super important. So flour is oxidized as well, so it starts to lose nutrients that way as well. And then I personally, if I ever choose to have dairy, it is raw, and I do cook at home, and I do like my raw cheese, but it still has, once it's been pasteurized and homogenized, it loses all its,
Yeah.
digestive enzymes and everything that's good for it. So if you can find raw, that's preferable. But once it's gone through that process of being pasteurized and homogenized, and it's just sugar water with added vitamin A and D,
Yeah.
and synthetic vitamin A and D. So
Remember what my key words were try to avoid. I know children with sensory issues, it's a challenge, and my hat's off to parents with children with autism. It is a struggle.
Okay, so another question. As a practitioner in Georgia, is it my understanding he has education and classes? So you have education and classes for practitioners, correct?
That's
Yeah.
correct. On things fatty acid, phospholipid, and plasmalogen, that's the DNA course, dnadr.org. It's an online course to start with to understand the basics of fatty acids and phospholipids. And then if a practitioner finishes that, then they can go on to the workshop where we try to interpret test results and put it into a personalized treatment plan. There is no protocol. The protocol is designed by each practitioner according to the test results of that individual patient.
Okay, question from Kathleen. If a child is an extremely picky eater, they all are, where would you recommend beginning with dietary changes? What is the most important thing to do?
Avoid mycotoxins. Mycotoxins are found, again, particularly in dairy and grains. Anything that's dried out could be cured meats, dried fruit, nuts and seeds. And so, coffee and tea, those are the major ones. And so, avoiding mycotoxins. And nowadays, I think, and I can't tell you that I have the research knowledge around it, but I keep hearing about how EMFs are creating more and more mold and fungus within our homes. I'll just say that I'll agree for right now because I haven't looked into it. But that's the concern is that I like grapes. I wish I could eat them all the time. You just got to avoid the ones with mycotoxins. So avoiding as many mycotoxins, and they're particularly found in commercial foods. So your Cheetos of the world and Doritos of the world and cereals of the world are loaded with mycotoxins. The number one other one is peanut butter. Peanut butter, I mean, if you can substitute and go from peanut butter to sunflower butter or almond butter, you'll be doing yourself a favor. If you're curious, I would say, reach out to us. I think we're going to send out an email with if you want to learn more or get additional information. That's the way to do it. I would uh, avoid mycotoxins. That's the short answer.
And if I can add a couple 2 cents in there, as a mom who has been down this road and has had a picky eater and was able to recover her child, from a severe diagnosis to a fully functioning adult today. It took me a while. There were times where Noah threw food at me. I had to, and I began this process before there was anything gluten-free, dairy-free on the shelves. So it was very hard to make at home. And, these days there is so much available that is similar to regular food that's gluten-free, dairy-free, and especially soy-free as well. So remember and I'm going to be a little bit of a hard parent, who the parent is. But it does take some time. I mean, Noah threw food at me for a while before I actually got him to eat it. And the only thing that I could feed him back then was just real food, which was just meat, vegetables. I made my own French fries for him with olive oil. Just be conscious and do your best and a little bit at a time. And it is a learning process and it is a way of life. So I did this with my child. I feel like my son saved my life inadvertently. So it's beneficial to get the family on board. It makes it easier for them as well.
Yeah, and if you reach out to us, we do have a what we call a LRT shake. It's a combination of all things unprocessed, unadulterated substances that provides a low carb, high protein, high fat shake for kids. And if you do it right, you'll taste just like a chocolate shake. And it's got all of the amino acids, fatty acids, essential fatty acids, all mixed into one. That LRT shake is the best way a child can start the day, or even adult for that matter. It is, again, low carb, good proteins, good fats, not affected by heat, and we'll be happy to send that out.
Awesome. Next question. How do I learn more about applying this to my practice? Do you only allow medical professionals or can anyone take the class?
Anyone can take the course, and it's just really about your understanding of the knowledge, and we can work through that. And that's why the online course, it's a study on your own time. It might take you a little while or longer. It makes no difference to us. The workshop is case-based so that you can kind of understand what the interpretation of the lab results are mean. It's by no means to try to make you into a practitioner, but it'll give you the basis of trying to figure out what's low, what's normal, what's high, and what to do about it.
Okay, next question from Elena. What are your favorite remedies to clean up mycotoxins after the triggers have been identified and removed?
Yeah, the number one agent found in our body is still glutathione. Glutathione, you can take that, and that by itself will trap mycotoxins. The next thing right after that is the phospholipids. And I should kind of say this, I didn't have a slide that says this, but as mycotoxins go into cells, the phospholipids surround it and put it into kind of like a balloon and push it out of the cell. And from there, in the bloodstream, there's two things that can help to get it to the liver so we can get it out of our body. Number one is albumin, a natural protein made by the liver. The other one is glutathione. So among those three things, phospholipids, glutathione, are the two things that can help reduce mycotoxin burden.
Okay, next question, Ravi. What is the root cause of eczema? Can it be cured?
So eczema is just a form of autoimmune disorder, and it starts with the gut. It starts with the kind of foods that we eat that are permeating through the gut lining, or better known as the leaky gut. And now the immune system is triggered by whatever food it is. Usually it's dairy, it doesn't always have to be, but there's other things that can do it. And there's a cross reaction with the proteins found in our skin that creates eczema. Sometimes it's a deficiency of good fatty acids, and fatty acids should be, again, derived from the foods that we eat. And this is where we want to stay away from cooked seed oils, only cooked, not uh, unprocessed seed oils are still okay, but there's no such thing, generally speaking. That's why there's the essential vital fatty acids that's on this list. But if you fix the leakiness in the gut, start eating the right foods or do a test if you really had to, called the ALCAT test, ALCAT. You can identify the foods that are really triggering the immune system, for delayed hypersensitivity. And that's really what eczema is, between immediate reaction by the immune system versus a delayed reaction by the immune system. The ALCAT test can point out those kind of foods. And then, of course, take something like butyrate to help fix that leaky gut.
All right, next question. Do plasmalogens also help with heavy metals? And is it dose dependent?
I could not find any no information that plasmalogens participate in that kind of exocytosis or the moving out of heavy metals. I could be wrong, but they're not made into what are called lipid droplets. Only phospholipids are. So the issue where they do have some benefit is that they act as an antioxidant within the cell. So they are helpful there. What I showed you with the double bond in a plasmalogen being in a straight line, that prevents the oxidation of the phospholipids and the plasmalogens themselves. And so it acts as a local sponge, is the best way I can say it, inside the cell. But ultimately, the movement away out of the cell is still phospholipids. So helpful, definitely helpful, but not as nearly as much as phospholipids.
Okay. So Julian asks, what kind of potential is there with seizure activity with plasmalogens? And I wanted to add something before you answer that question. I have a very dear friend of mine whose son, who's 19 years old now, has regular grand mal seizures, and she had to work her way up to taking the neuro. Usually you start with the glia and then you move to the neuro, but the neuro has literally saved his life. He was seizing so much that she didn't think that he was going to live much longer. And she was very regular with it, but it's made a huge difference. So I'll let you answer that
Yeah.
not a
And
professional level.
and the question was, what role does it have in
Yeah,
seizures?
seizure activity, yes.
Yeah. So the prodrome glia is rebuilding the myelin sheath. And that is the biggest concern in seizure disorders is that why is the myelin sheath being destroyed or damaged, or why is it not abundant as it should be? Because just like the electrical cord example analogy I was using, you're saying that now the transmission of the nerve signal is not going to the other end of the nerve cell. Instead, it's being directed to another nerve cell that's adjacent. And that's what is basically seizure disorder is uncontrolled electrical activity of nerve cells. And the
So what's the
traditional,
benefit of the neuro?
so the neuro helps to start the signal. Glia helps to get it from one end to the other end. So that's where prodome neuro, we want to start at second and very low amounts because you may not have an issue with starting the signal. It may be just getting it from one end to the other end. And so usually very small amounts of DHA or plasmalogen, which is what the neuro is needed. I hope that answers the question. I don't know if that was what was the question was about, how much to use or why things
Well,
might.
I gave him a breakdown of what Dr. Goodnow told me to do is typically to start with the glia,
Yep.
at least for the first couple months. And then once you've progressed and increased the glia, then add the neuro. The neuro, from what he told me, is best taken during the day, and then the glia best taken at night. So if you have anything to add to that.
No, I think that's exactly what I just said. Glia starts to rebuild that myelin sheath, and that's really the more important thing, at least for seizure disorders. And then you follow up with, do I need a little bit more of the neuro? But again, you can kind of see that on testing. You'll find out how much neuro do you need. If the DHA phospholipids and the DHA plasmalogens, if their levels look good, then you don't need as much neuro and you need a very small amount. It's a way of kind of knowing where those levels are.
Okay, so Cynthia asks, my daughter uses or used to take Membrane Health PL, which is no longer available, at least that I am aware. Currently, she's taking Body Bio PC, but would you recommend the Precision Nutrient PL instead of the PC?
Is exactly the same. The answer is yes. So
Okay.
it's gone from membrane PL to essential PL.
Okay. Amy asks, if someone has the CBS genetic mutation, what would they take instead of glutathione?
I'm not familiar with that mutation, so I'm going to defer. I don't. I'm not sure. You said CBS or is it?
Yeah, it says CBS genetic mutation. I've never heard of it either.
I'm not familiar. I can look it up and get back to her.
Okay. Okay. Now, last question, and feel free to add any more before we end this, but currently this is the
Yeah.
last one. Can we please get a recording? Oh, yes, you can get a recording. That's for me. Yes. So after this, we fully recorded everything and I'll have to upload it and then my guy has to put it on our website. So it is the weekend. Usually he'll do it on the weekend. She says that CBS is involved with sulfur metab.
Okay. Well, in that case, taking and every person's different. I'm not trying to provide medical advice here, but take if you're unable to take glutathione, then or someone in general, really you should take the precursors to that and taking the amino acids either there's a formulation called that's specific for making glutathione on your own is the way to go to resupply your own glutathione without taking commercial glutathione. I also kind of wonder, there's, of course, two kinds of glutathione. There's glutathione or reduced glutathione, if that was utilized. The other concern sometimes is that there is a type of glutathione that's considered the gold standard in glutathione called Cetria, Setria glutathione. It is a more stable glutathione. I always get a little concerned about substituting. Not all supplements are created equal, and just like in the phospholipid world. And there's a possibility that if there's a issue with the capsule or the coating, that it's or the admixed into a liquid, if there's something there. I understand the genetic mutation here, but the other thing that comes to mind is the quality of the glutathione.
Okay.
So look for Cetria glutathione.
What are your thoughts coming from me while we're on the subject of glutathione, the glutathione cream?
I I've seen the companies that recommend that. What I didn't, and I'm not saying yes or no, Tracy. What I'm saying is that I could not find before and after glutathione levels, well, what we call epigenetic studies. That means that, hey, I took this and then I measured before and after, and here's how it changed my levels. And so it sounds correct, but I couldn't find the data uh, from the companies that said this actually increases my glutathione levels. So I'm still a little question mark about recommending topical glutathione.
Okay, somebody asked, overall, what is more useful for autism kids, neuro or glia? I did put that they're both quite useful. Glia you would start, and then neuro you'd
Yeah,
add.
absolutely. Glia comes first, then neuro if needed. But really, it begs the question, And this is where maybe perhaps I didn't say it out loud today. You have to wonder, why aren't you making your own fatty acids, phospholipids, and plasmalogens? And it goes back to gut health and liver health, or even nutrition for that matter. And so while plasmalogens and phospholipids are a nice, what's the word? Kind of like a stepping stone to health, we really should be analyzing what's going on in our liver that we can't make these endoplasmic reticulum or the Golgi apparatus or the peroxisomes.
And then there's another last question from Linda. Can you explain what causes a meltdown and will glia and or neuro help?
I don't know
It's a
for a
loaded
fact,
question.
but I'll tell you, kids are, I think we're talking about a pediatric age, all kinds of things. Usually it's something that's going on in the brain. And I'd have to say it's usually a little bit of brain inflammation. That's number one. Or it's for a lack of a better word, it's a behavior issue where they can't tell you what's going on, and so they feel frustrated. And it,
Communication.
yeah, it's a communication thing. And so, unfortunately, it's kind of like that whole idea of being a veterinarian, and when a, a pet or an animal can't talk to you, you got to go figure out what's going on. I mean, is it simply I'm tired, I'm hungry, I'm having a headache, or I don't feel good because I got an infection somewhere? It could be any and many other things.
What about a PANS pandas flare?
Oh, I mean, that's brain inflammation, by the way.
Yeah.
Pans and pandas is brain inflammation. And the quicker you reduce that inflammation, the better they'll feel.
Okay, recommendation, I'm gonna assume for the plasmalogen supplements for adults. It's very similar, right?
Yeah, plasmalogens again. What Dr. Goodnow has created are plasmalogens. They're not the only ones on the market, but they are the most effective because there is scallop derived plasmalogen. It's just that the dosing on that is so small. I can't say that it's very helpful. So it's out there. It's made in Japan from scallops, but plasmalogens are precursors. We're still relying on our gut and our liver and our cells to convert them from precursors to finally the ultimate product. So what I mean by that plasmalogen precursor is that second position, that's why I showed the picture of the plasmalogen, that second fatty acid or the R2 position, we're hoping that once that plasmalogen gets in, that our cells will attach the right fatty acid in that second position. In the case of plasmalogens or phospholipids, it needs to be a polyunsaturated fat, whether it's DHA or EPA. And this goes back to the idea of the healthiness of the liver and the peroxisomes and the endoplasmic reticulum. That's where the assembly occurs. So you have to take the plasmalogens and the fatty acids that go into that second position. And that way they're more effective.
So does it depend also on the severity of the condition of the individual based on how much you increase your plasmalogen supplementation to?
Yeah, so sometimes, yes, the answer is yes. Sometimes you might have one material more so than the other. So if you're taking plasmalogens, make sure you have the fatty acids, or if you're taking fatty acids, make sure you have the plasmalogen or the phospholipid in that matter. And again, the phospholipids are to be converted into plasmalogens. That's the natural biochemistry of that process is convert phospholipids to plasmalogens.
So another question from Cynthia, follow up on Pan's Pandas questions. Do you have any recommendations for what you do or use to quickly reduce the inflammation?
In general, I don't know the case, but things like glutathione is very helpful. So are phospholipids. They will start trapping the toxin that's produced, and those would be the two recommendations. But everyone's person, everyone's different. Sometimes utilizing third generation cephalosporins could be beneficial, but inflammation otherwise, I would say go with glutathione.
Okay, how about in my own experience, because I do have a son who's had, severe pandas. Um, you know, we first started off with our doctor recommended um, antibiotics, which tore up his gut again, along with IVIG treatments, which I didn't feel that worked very well, but I know is highly recommended. But then we moved on to high dose vitamin C IVs, which did help. But the one thing that really knocked it out, and I know it's a little invasive and it's
Yes.
a little hard to get a kid to sit
Yeah.
still for it, is we boosted, we started off with, IV ozone and we moved up to a 10 pass. So we started with a 2 pass and then a 4 and that kicked it out. And so to me, as a mom who has been there with her child who's suffered severely from pandas, and I have to constantly watch his numbers, that was probably the most successful. Your thoughts?
Yeah, I would totally agree that that's doing IVs on kids. Yeah, it's variable. I mean, some kids are okay with it and some kids are not. If you can do it and you can financially afford it, absolutely.
On the financially affording part, because I'm a creator in life, right? Which is why I wrote my story in my book, Warrior Mom, was to really inspire families that please don't get stuck on the cost of things. During the time of Noah's diagnosis, we literally, our house was in foreclosure. My husband lost his business, and it couldn't have been much worse. But I bartered for treatments. I negotiated. I set a clear intention that my son was going to receive every single treatment that he needed, to heal his body. And once I set that goal, I achieved it. And so I do say, aim high, and you always can negotiate, and I always put on that parent face, like, please don't say no to me. Um, but I'm pro for setting a clear intention. Um, so if nobody has any other further questions, and I don't see any in the Q&A, I'm going to go ahead and stop the recording. Wait, no, I'm not going to stop the recording. I have a couple more things, just a couple more things. So Dr. Doniparthi is also going to be speaking at our upcoming Autism Health Summit. So I'm going to just, I'm going to, as soon as I can. Sorry, guys. Can't get to my slideshow here. All right. So Autism Health Summit is April 24th through the 26th. And this is our flagship educational event. Dr. Dharnaparthy will be one of our speakers. This brings together leading voices in research, medicine, advocacy, integrative health for 3 powerful days, actually 2.5. And so you can, learn, connect with other families and practitioners and collaborate. Our headline speakers this year are Aaron Seary, Del Bigtree, Dr. Toby Rogers, and there are so many other respected leaders and health professionals. I wish I had room on the slide to put all of them. You can go to ahsconference.com. You can also get the link through autismhealth.com. It will be in San Diego at the lovely Legacy Center Resort and Spa. You can also, uh, use the QR code to register. And if you use promo code AHS25, you can get $25 off your registration. And again, I truly want to thank you all for attending. I want to thank Dr. Doniparthi and his lovely wife for their time today because it is a Saturday. I am truly grateful to you both. I'm grateful for what you have done for individuals with autism, your healing journey, and everything that you've created. Again, to all of you out there, if you wouldn't mind scanning this QR code and, making even just the smallest donation would make a really big difference to us. We are a very small organization, but we are growing, substantially. And we got some amazing things coming up. We have a clinical trial with Cellular Performance Institute and Ed Clay for stem cell therapy for individuals with autism coming up soon. Del Bigtree is going to be doing a documentary on it. Super excited. We have partnered with Dr. Goodnow Enterprises in regards to getting plasmalogen supplements to families. If you require more information on that, you can always reach out to me at tracy@autismhealth.com, and that's TRACY. So I am truly grateful for everyone's attendance today. And thank you all for joining us. I do see one last question real quick. Julian, how do you know when it's time to increase the glia? So we'll ask one more question.
Intended effect. If you feel like what I've noticed with children who take glia, they sleep better, their choices of foods increase, they're more calm, and or other things that are going on. They're more instructive, meaning at school they're paying more attention, and that's the best way is just really is clinical outcomes, and that way you know that you can reduce the amount. But I would usually give it about 6 months of glia supplementation before going to a lower dose.
Okay. I had a question, but I can't think of it now. But in regards to severity, so I keep bringing this up because Dr. Goodnow always says it really depends on the severity of the individual, whether it's a child or an adult, as to, how much glia you increase to. Some individuals require, as he said, to be increased to like a bottle a week, which has shown great progress for individuals. I love his success stories. He is also a sponsor at our conference. He will be speaking twice, both Friday and Saturday. He'll be speaking on the benefits of plasmalogens for autism, and then also the benefits of plasmalogens for other related neurological disorders, because there are so many different types of disorders that deserve to be addressed. But it is a wonderful supplement. Me and my whole family take it. I highly recommend it. And I highly recommend that you book your consultation with Dr. Doniparthi. He is an absolute genius and he knows his stuff. So I truly trust, his ability to take care of your children. And on that note, I want to thank you all for joining us, and I'm going to go ahead and stop the recording.
Thanks, Tracy. Thanks, everyone.